Hello, my name is Paulina Flores. I am an 8th semester medical student. This is a video from my English class. This video is about a clinical case.
Well, the clinical case that I will present to you is about a 36-year-old woman. She's a full-time secretary, married, and has an 11-year-old son. Actually presents complaining of spontaneous bruising, mainly in her legs. The bruising has been noticeable over the last 4 and 6 weeks. She cannot remember any episodes of trauma. In addition, her last 2 menstrual periods have been abnormally heavy and she has suffered a major nosebleed. To personal pathological history, there is no significant past medical history, denies chronic degenerative disease, denies surgeries, and denies allergies. To family history, there is no family history of a bleeding disorder or another pathology. To social history, she denies being a smoker, a small amount of alcohol socially. For the physical examination, it has been made chorocephalic, orient in the 3 spheres, oral cavity well hydrated without alterations, cylindrical neck without adenomegalies, lung filled with good air intake. There are multiple areas of purpura on her legs and to a lesser extent on her abdomen and arms. The purpuric lesions vary in color from black, purple to yellow, as seen in the last image. They are not signs of anemia, but there are 2 bullae in the mouth and there is spontaneous bleeding from the gums. There are no retinal images of fundoscopy. Examination of the cardiovascular, respiratory, and abdominal system is unremarkable. Her vital signs when examined: blood pressure is 118 of the 17 of millimeter of mercury, pulse 17 beats per minute, respiratory 18 per minute, and temperature 36. In laboratory results, the only thing that was altered was hemoglobin with 10.9 grams on deciliter. For the diagnosis, this woman has spontaneous bruising due to idiopathic thrombocytopenia purpura. She has profound thrombocytopenia with a platelet count of 4 per 10. An increased tendency to bleed or bruise can be due either to platelet coagulation or blood vessel abnormalities. Platelet vessel wall defects cause spontaneous purpura in the skin and mucous membranes or immediately after trauma. The distribution of bruising may suggest the diagnosis. Thrombocytopenia purpura is more evident over the ankles and pressure areas. Senile purpura and steroid-induced bruising occur mainly of the forearms and dorsal zone of the hand. To differential diagnosis, the cause of thrombocytopenia can be divided into disorder of reduced production of platelets or decreased survival of platelets. Decreased production of platelets can be due to marrow infiltration, for example by leukemia or malignancy, or a result of toxins, for example alcohol, drugs, radiation, or viruses. For the treatment can be divided into medical and surgical management. Medical management is further divided into first line and second line pharmacotherapy. Supportive therapy by a team experienced in the variable course and outcome of ITP is crucial. Medical options for frontline drug therapy are corticosteroids, intravenous immunoglobulin, and IVRH anti-D. The surgical management is the splenectomy, but is not a favorite option for treating ETP in children. That's all for my video and thanks for watching.